I think when you're diagnosed with cancer, it can't hurt to get a second opinion. You know, most of the time we don't necessarily have to rush into a decision immediately. You do have a window of time where it's better to make sure that the treatment plan is laid out correctly from the beginning, and a lot of times the second opinion will help establish that. For example, there can be different interpretation of tests, or just having more people review the data about you can sometimes be more enlightening. The other time to get a second opinion is maybe if you're already on a treatment course and then it's working, but then the treatment stops working. So before you start the next treatment, you can be anticipating that you might want to get a second opinion so that, again, you can make the right decision rather than rushing into something that may not be as beneficial.
And a good doctor shouldn't object to getting second opinions. I say if your doctor doesn't want you to get a second opinion, that means you don't need a second opinion, you need a new doctor.
When you're diagnosed with a particular disease, first and foremost, go to your family physician and get the information that he or she can provide to you about that disease. But don't hesitate to ask that individual for recommendations regarding how you, the patient, might acquire additional information, including seeking a second opinion.
Because it really is true that you have the greatest number of options before you've started treatment. If you get one dose of chemotherapy, instantly limits your therapeutic options, especially for research protocols, because they often require people who've never had chemotherapy. So again, community physicians will often tell their patients that if the patient asks them if they can get a second opinion, they'll say, yeah, I think it's a good idea, but let me give you a dose of chemotherapy before you go, just to get the treatment started. And they know full well that that means that will make the patient ineligible for treatment protocols, and very likely will make the patient stay with them as one of their patients instead of getting offered treatment somewhere else.
Sometimes people think, well, if I go for a second opinion, it means that I have to go to some big center that might be very far away from my home. In reality, the second opinion is usually to work with the local physician to get everyone on the same page in terms of the diagnosis, the stage, the genetic features, and the treatments that are available. And it doesn't mean that you're going to go to some huge center far away to get the treatment necessarily. So having the local physician and the second opinion physician in communication and in direct communication with the patient is the optimal way for a second opinion to happen. A second opinion doesn't imply that you have a bad doctor. It doesn't imply you're going to leave your doctor. And it doesn't imply that your treatment is going to have to be someplace other than close to your home.
You're going to be faced with therapeutic decision points down the road. When your tumor comes back, which it in advanced disease almost always does, there's another branch in the road decision that you have to make. And there's nothing wrong with getting multiple opinions at that point as well. There are so many new drugs being developed today that patients should seek out trials, or at least seek out the appropriateness of their situation for a trial.
This is your life, and I think a second opinion is a really worthwhile thing in any cancer, but especially lung cancer. As the field quickly moves forward, not every community physician or surgeon knows everything, and therefore you have to be willing to look at a second opinion. When I first got out of my into my practice at California, what I would call very young woman came to see me because she was my age, and she had been diagnosed in the Central Valley with what they thought was 3A lung cancer, and the doctors told her, you can't have surgery, you're just going to have chemo, and you're probably going to die. And she was devastated, and she came to see me, and sure, by the CT and the PET, she easily could have had 3A lung cancer, but no one had done a biopsy. So we biopsied her, and her lymph nodes, which they thought harbored cancer, just had valley fever in him, and we resected her very small lung cancer, and she did beautifully. And her dad sends me a case of asparagus every year at Easter. And it was just this wake-up call that, not that her doctors were bad, but that they hadn't taken the extra step. They weren't lung cancer experts. And there are experts out there. They're usually at big universities. They're usually in big cities. But this is your life, and if you're not happy with the answer, it's worth seeking out that opinion. They might be able to offer you a clinical trial, a special drug, a new therapy, new techniques that may not be available in every small town. They may tell you the same exact thing your first doctor did, but now you've got a little better feel that this is what your course is. So I always think it's really important.